This video gives you an example of RehaMove leg training in adaptive mode. Choose the patient and press the next button. Select the button for RehaMove leg and choose Adaptive in the next window. Choose one of the pre-defined parameter templates. We choose Spinal Cord Injury, SCI, and the Power Motor Incomplete template. We recommend using adaptive mode for patients with incomplete spinal cord injury or stroke. The stimulation intensity adjusts automatically to the patient's active performance. In our Power Motor Incomplete template, we have a short stimulation time and a high intensity of frequency and pulse width, because we want to challenge the muscle's performance without the risk of fatigue. It is recommended then to find the motoric threshold of each muscle and not only the sensory threshold. We carry out the current test very carefully. At first, for the right quadriceps, QU yellow and red, and afterwards for the right biceps femoris, BF yellow and blue. Then, we have to do the same for the left side, quadriceps, QU green and red, and the left biceps femoris, BF green and blue. We always confirm our entries by pressing the knob. Then we have to name our template, and we choose Power, related to our predefined template. Now we can start the RehaMove leg training by pressing the Start Training or Start Therapy Session button. Remember that we have chosen the adaptive mode. Our template already has predefined values for the range of pulse width, but you're able to adjust the minimum and maximum value by pressing the gear wheel button once the training session has started. If you press the button for pulse width, you can adjust the minimum and maximum value with the knob. If the patient begins actively cycling, the pulse width will automatically adapt to the level of activity of the patient. If the patient is very active, the pulse width will decrease to the minimum pulse width allowed. If the patient has a lower level of activity, the pulse width will automatically increase. If the training intensity is too low for your patient, you are able to increase resistance and decrease the speed. The patient now needs to cycle more actively at a certain speed and may need less stimulation support. After we have completed the training, we will automatically be forwarded to the cool down.